Nowadays, we hear many of our friends, neighbors, family taking multivitamins. Now, what are multivitamins, and should we all take multivitamins? Nutrients are classified into two parts: the macronutrients, in which our body needs them in large amounts, and the micronutrients, in which our body needs in small amounts. The micronutrients are further classified into the vitamins and minerals. They are the building blocks that keep our bodies running, so our body needs them to develop and function normally. However, they are not produced naturally by our bodies, and hence we need to get them from outer source. So how are they taken into our bodies? We consume them from our diet. Vitamins are organic substances, and organic substances means they contain a carbon atom. They are generally classified as either fat-soluble or water-soluble. The water-soluble vitamins, which are the vitamin C and the vitamin B complex vitamins, which are 8, the B1, B2, B3, B5, B6, B7, B9, and B12. As their name says, they are water-soluble, so they dissolve in water, and once they are inside our system, they are digested and taken up by the blood directly, as the plasma is water-based. Plasma is made up of 90% water, and hence they are readily absorbed into tissues for immediate use. In addition, not only they are absorbed rapidly, but also they are excreted directly through the kidney if unused, and further lost in urine. And therefore, they are not stored for long duration, so we need to take them regularly in our diet. Now, for the fat-soluble vitamins, they are the vitamin A, D, E, and vitamin K. They are similar to oil, that's why they are fat-soluble, and they don't dissolve in water. Fat-soluble vitamins are most abundant in high fatty foods and are much better absorbed into our bloodstream when they are eaten with fat. They are taken to the stomach and intestine, where there is an acidic substance called the bile, which flows in from the liver, breaking the fat and preparing it for absorption through the intestinal wall. And since the blood nature is water, then fat-soluble vitamins require something to move them around in the blood, which are proteins. Now, proteins attach to vitamins and act as carriers, transporting them through the blood. Fat-soluble vitamins tend to accumulate and are stored in the liver and fat cells, where they are released when needed. Because the fat-soluble vitamins are not readily excreted, they can accumulate to toxic levels if taken in excess. Where a well-balanced diet doesn't cause toxicity, overdosing on fat-soluble vitamin supplements can. Now for the minerals. Minerals are inorganic elements. Inorganic means they don't have a carbon element. These are two kinds of minerals: the macro minerals, which we need them in a large amount, such as the calcium, the phosphorus, the magnesium, sodium, potassium, chloride, and sulfur, and the trace minerals, which we need them in small amounts, and they include the iron, the manganese, copper, iodine, zinc, cobalt, fluoride, and selenium. A diet that includes plenty of fruits, vegetables, whole grains, good proteins, healthful fats should provide most of the nutrients needed for good health and functioning, and hence eating a healthy diet doesn't require taking multivitamins, as the diet we are taking contains them in addition to other beneficial things like fibers. That's why getting them by diet is more preferred. However, multivitamins can play an important role only when nutritional requirements are not met through the diet alone, and that situation we will be needing multivitamins. Examples of some cases that might require multivitamin use include the pregnancy, the infancy, documented vitamin deficiency, a doctor's recommendation, restrictive diet, or the vegans, chronic conditions such as malabsorptions, and some medications as well. These nutrients, they are beneficial to our bodies when taken through the diet, as the diet is able to supply us with all these nutrients and vitamins and minerals. However, the use of supplements, especially the lipid-soluble vitamins, as they tend to accumulate and stored, as we mentioned previously, may sometimes cause toxicity or even drug interaction with a medication you are using, and thus they are only used when indicated in special population or when deficient. This video was a brief introduction about the vitamins, the minerals, the multivitamin supplements, and in the next videos we're going to talk specifically about each vitamin.